Now come in, do hand hygiene. Hi, I'm your nurse today. We'll do some cranial nerve testing, okay?
Okay.
For rising privacy, just follow my instructions. I'm going to test cranial nerve 2 through 12. Now, the cranial nerve 1 is the olfactory cranial nerve, but we're not going to test that today, okay? So we'll go with cranial nerve 2, the optic nerve. I want you just to pay attention to me, okay?
Okay.
I want you to cover your right eye, and I'll cover this eye. I'm going to put up some fingers, and I want you to tell me how many I put up, okay? Ready?
2. 1. 2.
Cover your other eye.
3. 1. 2.
There you go. Thank you so much. I would also test the visual acuity using the Snelling chart. We'll have him stand 20 feet away from the Snelling chart. If he was to wear eyeglasses, I would ask him to down the eyeglasses. And then I would ask him to read the line with the smallest letters that he can as possible. If he missed 3 letters, I would ask him to read the line above it. And that will show his visual acuity. I would have him read the line in his left eye, his right eye, and then both eyes. And that's visual acuity. Cranial nerve 3, ocular motor. I'm going to ask you to look at me, look straight at me, look at my eye right here, and I want you to follow my pen light with your eyes and your eyes only. Ready?
Mm-hmm.
The stagnance is absent. Now I'm going to check see if his pupils are reactive to light. From the pen light. There's wrist constriction. Wrist constriction. I'm going to check indirect. His pupils are round, reactive to light. They're about 3 millimeters. Cranial nerve 3 is intact. Now I'm going to check cranial nerve 4. Cranial nerve 4 is for accommodation. I'm going to hold my finger 3 inches away from him. I'm going to ask you to follow my finger, sir. Down, inward and downward. Ready? His eyes are accommodating. And cranial nerve 4 is intact. I'm going to check cranial nerve 5 now. Can you bite down and chew? Just kind of bite down like that. I'm going to ask you to open your jaw. Try to open the eye. Move your head. Okay. I would also test cranial nerve 5 by checking the sensation of his face with a cotton ball of his face, his scalp, his cornea, the condition of his mucous membranes, and his nasal membranes with a cotton ball or a cotton tip probe. Everything is fine, so cranial nerve 5 is intact. Now I'll go to cranial nerve 6, which is abducens nerve. Abducens is checking for lateral eye movements. It was already checked when I checked cranial nerve 3, and I saw the lateral eye movement, so cranial nerve 6 is intact. Cranial nerve 7, the facial nerve. I'm asking you to bite down and chew. I'm asking you to state your name and date of birth.
Kobe Jones.
I want you to smile.
February 2nd, 2008.
Thank you. I want you to smile, frown, puff out your cheek, close your eyes, and close your mouth. Thank you. I will also test for the sensory part of this nerve by testing taste. I will have him taste something salty, sour, and sweet to help him identify those things. I will also try to produce tears by stimulating the cornea with a cotton ball. I will also try to produce salivation by having him eat something sour. Facial cranial nerve 7 is intact. Now we go to cranial nerve 8, which is the acoustic nerve, and we're going to assess hearing. So I'm going to plug up your ear right here, and I want you to tell me what word I'm saying. Okay?
Baseball.
Other side.
Football.
There you go. His hearing is intact. I will now go to cranial nerve 9, which is the glossopharyngeal nerve. I will test this nerve. I will have you just say ah, okay? As I look into your uvula is rising. I say ah. Now I'm going to stick my finger in the back of your mouth. Ah. Gag. Okay.
Yep.
Cranial nerve 9 is intact. We'll now go to cranial nerve 10, which is the vagus nerve. I'll have you to state your name and date of birth.
Kobe Jones, 2008.
There's no hoarseness when he's talking. Would you swallow for me? His swallowing is intact. Cranial nerve 10 is intact. Now we'll go to cranial nerve 11, which is the spinal accessory. So what I'm going to do is I'm going to touch your face, your head, your chin, and your shoulders. Turn your head to the side against my hand. Against my hand. Down. Up. Back. Shrug your shoulders. Alrighty. Cranial nerve 11 is intact. Now we go to cranial nerve 12, the hypoglossal nerve. I'll ask you simply to stick out your tongue in the middle of your mouth like this and move it from side to side. Alright, cranial nerve 12 is intact, and this concludes the cranial nerve assessment. Note that I forgot something with cranial nerve 8. I will also, other than hearing, I will test for equilibrium. We're not going to test that today, but that will be tested doing a full head to toe while observing the gait. Thank you.